This is Dr. Jess, and welcome to part 7 of Health Hacks with Dr. Jess. This will be a two-part series on adrenal fatigue, which I am terming the scourge of our time. Those who are joining us for the first time, I am Dr. Jess. I've been a healthcare provider for 50 years in various capacities. I have expertise in genetics, forensics, methylation, neuroendocrinology, functional medicine, nutrigenomics, and so forth. I have degrees in nursing. I've been a paramedic. I'm also a doctor of chiropractic. I've been known as the neurotransmitter whisperer and the Sherlock Holmes of chronic illness. Talk about what exactly is adrenal fatigue, what are the causations, in other words, how do you get it, what are the symptoms, and how it affects your life. Adrenal fatigue is a term used by some integrative and functional medicine people to describe a collection of nonspecific symptoms. Remember, it's not a diagnosis, it's a list of symptoms that include things like fatigue, body aches, nervousness or anxiety, brain fog, low blood pressure, cravings for salt or sweet foods, lightheadedness when standing up, and sleep disturbances. Theoretical basis. The idea behind adrenal fatigue is that chronic stress overworks the adrenal glands, and remember the adrenal glands produce things like cortisol, DHEA, which is short for dehydroxyepiandrosterone, and adrenaline, noradrenaline, and so forth. And over time, these glands supposedly can't keep up, leading to suboptimal hormone levels. Not enough to cause Addison's disease, but enough to cause symptoms. And this is an important point. The difference between traditional and non-traditional or functional or alternative medicine is that we tend to look at things that don't rise to the level of a recognized disease. What do I mean by that? Well, we tend to look at thyroid problems before they reach the level of hypothyroidism that shows up on a lab test. We look at functional hypothyroidism or low thyroid function way before it becomes the recognized condition called hypothyroidism. We look at gluten intolerance before it becomes, or way before it becomes, celiac disease. In the before time, like I told you, I've been around for a long time, the gastroenterologist did not believe that gluten intolerance could cause problems outside the gut, or they didn't believe in gluten intolerance at all until it got to the stage of celiac disease. Now they recognize it, but it was, believe me when I tell you, an uphill battle to get them to recognize that gluten can be a problem, even though it's not showing up on your tests and it's not showing up in the gut. It can show up elsewhere. The same thing with adrenal fatigue. If you don't have Addison's disease, which is complete true adrenal insufficiency, there's no such thing as adrenal fatigue. Well, there is, and the adrenals can be under stress and cause all kinds of symptoms, but not show up as the classic Addison's disease. Tell from this chart that things that affect the adrenal glands are multiple. Death of a loved ones, repeated stresses, infections, toxins, financial pressures, emotional stress, negative attitudes and beliefs, lack of relaxation, allergies, overexertion, psychological stress, unwanted underemployment, smoking, lack of sleep, fear, trauma, caffeine, too much caffeine, nutritional deficiencies, drugs and medications, poor eating habits, sugar and white flour, too much or too little exercise, wound healing, good Jess, marital stress, so forth and so on and so on and so on. In other words, practically everything that's going on in our society can affect the adrenals because we live in a toxic, high-stress society. There's no question about that. This causes illness is dysregulation of the HPA or hypothalamic pituitary adrenal axis rather than the effect on the adrenals themselves. Okay, and in my estimation, this is the main way because this interacts with other pathways. Not to get overly technical, let me run you through this, okay? You have a stressor. This is a normal response. And look at the top, the hypothalamus, which is in your brain. It stimulates the hypothalamus to release CRF, which is corticotropin releasing factor. And remember, when I say something fast, ignore it because it's right here. Okay, it's not important you know the big name. And that stimulates the pituitary gland that's also in your brain to release adrenal-corticotropin hormone, which is ACTH. Okay, and that stimulates your adrenal gland to release adrenaline, which is epinephrine, norepinephrine, which is noradrenaline, and the adrenal cortex to release cortisol, one of the stress hormones, and DHEA, dehydroxyepiandrosterone, which is the other stress hormone, but it goes into the sex hormone pathway, and as a result of that, you get testosterone, and then that converts to estrogen. Okay? So that's what happens in a normal stress response. And then the cortisol, if you look at the right-hand side with the arrows going up, okay, ignore the LC thing over here. Just look at the hypothalamus and pituitary. You have these receptors. They're in blue. And the cortisol goes up to the receptors and turns off the reaction. Okay. And even though I explained that easily, I know that it's confusing for most people. So let's use a well-known way of explaining this. Okay. The Incredible Hulk. For those of you who are my age, I know I'm an old guy. Okay, the original Incredible Hulk was this guy Bill Bixby, who played Dr. Bannon. Dr. Bannon. He's on the left-hand side there. Now he would go into town. Okay, think of Dr. Bannon as the hypothalamus. Okay, and people would start insulting him and messing with him and so forth, and then he would get more nervous, and then he would look at you and say with those eyes, "You wouldn't like me when I'm mad." Well, that's the stimulation of the pituitary. That pituitary releases its hormone, and it releases all those excitatory neurotransmitters and hormones, the DHEA, cortisol, epinephrine, norepinephrine, and you become the Hulk. Okay, and in the show, the Hulk would take off and destroy things and so forth and so on. And at the end of every episode, you would see the Hulk, who was Lou Ferrigno, okay, kind of looked like he was getting ready to go to sleep. And the next scene would be Dr. Bannon again, thumbing his way because he had to leave town. Okay, that's the cortisol going up to the brain and turning off the reaction. Okay, and that's the normal HPA response that we normally call things like fight or flight. Let me show you what happens during chronic stress. Okay, the early chronic stress response. Look at the hypothalamus, which is that green thing up in the left-hand corner. Okay, and there's a lot of stimulation. Those are the arrows. Okay, it releases a lot of the hormone. Okay, which tells the pituitary to release a lot of its hormone, which tells the adrenal gland to release a lot of adrenaline, a lot of noradrenaline, a lot of cortisol, a lot of DHEA. Now, what usually happens here is that that's trying to stimulate or actually fill in those receptors on the hypothalamus and pituitary. And you notice that some of them are green instead of blue, and that's a desensitized receptor. It's getting so much stimulation that not all the stimulation is getting through, and it becomes dysfunctional. Okay, and mid-stage chronic stress is the same amount of stimulation. Okay, yet the receptors, look at the green things on hypothalamus and pituitary, are not receiving all the signals or any signals at all. What happens here? Well, there's chronic stimulation of the adrenal gland that never gets turned off. The fact is that our adrenal glands, that fight or flight response, we're adapted to have that once every 6 weeks, not 4, 5, 6 times a day like you listen to your news radio station. Okay, and we live in such a chronic stress society that we get these triggers multiple times a day. So what ends up happening is you get this chronic stress response, and it keeps on going and going, and goes from the acute chronic stress response to this mid stage, and even worse after that. The late chronic stress response is the receptors are not getting the signals. There's loads of stimulation on the hypothalamus, but the pituitary is tired. Okay, the adrenal glands get exhausted and don't release a lot of epinephrine. Look at the epinephrine, look at the norepinephrine, look at the cortisol, and look at the DHEA. And right now, this is adrenal fatigue. Okay, so you're getting all the stimulation, but your body cannot respond to it. And epinephrine and norepinephrine, they're responsible for your ability to pay attention, to focus, to just be awake and just respond to everything in the environment, whereas cortisol is important for regulating blood pressure and DHEA is important for the sex hormone cascade. It does a lot of other things too, but you can see just from what I'm saying how pervasive the response will be. You can excuse the crudity of the graphic here, okay, because I kind of did it by hand. Okay, but when you do a cortisol test, doing a single cortisol number is worthless. Doing it 4 times over the period of a day tells you what's going on. Look at the red dots and look at the green. Okay, the green is the normal. Okay, what you should start off in the morning on the left-hand side. Okay, with your cortisol high. Okay, and then it starts going down during the day, and at the end of the day, it should be at its lowest, so you can go to sleep. So, in a stage one or early chronic stress response, this is kind of the way you're going to see it. It looks kind of normal. But then when you get to the mid-stage response, what ends up happening is you start getting this sawtooth type pattern. This is the black dots, okay? And you may see it in the morning on the lower side, then high, then low, then high. Okay, but there's a lot of variations, but it always has this sawtooth pattern. When stage 3 or that chronic response happens, you start getting what's on the bottom with the blue squares, okay? Where it's really low and almost flat, and that's where adrenal fatigue happens. Okay, and this is one way you can diagnose it, the one way you can tell, hey, what the heck is going on. But there's more happening here than just cortisol. So you don't want to just give adrenal cortex. There's much more happening. Also, also, there are neurotransmitter imbalances, okay? And neurotransmitter testing can give you the balance of your neurotransmitters, and with the right practitioner interpreting it, you can tell why you're having mood problems, what's where the imbalance is, and really if the person's good, frankly, like myself, because I teach this course, okay, you can tell how long it's been an issue, okay. So one of the ways of dealing with mood issues, okay, things where they always tell you to take serotonin reuptake inhibitors in case you have depression. If a test like this were done, even though it's not super exact because it's a mixture of peripheral and central nervous system, the pattern would tell you where the imbalance is. So if the person had normal serotonin and let's say low adrenaline, noradrenaline, dopamine, that kind of stuff, you would want to use a different medicine if you're going to use medicines to start out with rather than a serotonin reuptake inhibitor, okay? Because things like depression and anxiety and all the different mood disorders you can think of, ADD and HD, yada, 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 all have different patterns, okay? They don't have specific patterns, they have different patterns, okay? And it's very individualized. So the combination of a salivary cortisol test and this will tell you exactly where the dysfunctions are, where the imbalances are, and then you can use that as a starting point for your therapy, be it pharmaceutical or nutraceutical. So next week, we're going to talk about how to treat adrenal fatigue naturally, including lifestyle changes, supplements, glandulars, insomnia treatment, and a whole lot more. So I hope you join me. Ever tell your friends about my YouTube channel, okay? Because over the next few months, you're going to be learning an awful lot, and it's going to be directed towards you being able to take care of yourself and to recognize things that usually aren't recognized by most practitioners, and you can take charge of your health, okay? If you have particular questions, and people are starting to email me more and more now, just email me at jess.jessorun.com. And if you want to have a 30-minute get acquainted phone conference, if you want to know if I can help you professionally, you can get a free 30-minute get acquainted conference by just going to my website. Why would you want to treat with me? Well, I'm very well educated. I have lots of healthcare experience with in different areas, and I have 5 decades of experience in April 2025. It's exactly 50 years. And frankly, I'm the doctor that will give you the time and empathy you need. And as always, if no one told you that they love you today, remember, Dr. Jess does. I'll see you next week.